Hey guys, this is Jay Patel, one of the PA here at MyFitMed. Today we'll talk about testosterone replacement therapy and how it affects your fertility. Lately, we've been getting a lot of younger patients in their mid-30s who have clinically low level of testosterone and have all the classic symptoms of low testosterone. These are the patients still considering having kids in the future. So for them, fertility is important. So we'll talk about TRT and fertility. If you are on TRT or if you start TRT, it actually lowers your sperm count. It lowers your fertility. It doesn't make you completely sterile, but the number of sperm goes down depending on how long you do the TRT for. If you are not on TRT and have the symptoms, but if you have never done TRT, I would recommend is hold on to the TRT first. Do everything naturally. Take supplement that can boost your natural testosterone. We'll talk about how to boost your natural testosterone in a separate video, but do everything that you can to naturally improve your testosterone. Doing it naturally is not going to take your levels from 200 to 900. If it improves your level and if it improves your symptoms, then you can wait on starting the TRT until you're done having kids. If your symptoms are still not improving using natural supplements and trying to boost it naturally, and then if you really have to start TRT, then consider a testosterone boosting therapy, and I have talked about this in a separate video. Go see a testosterone boosting video. So you can use HCG or Clomid to boost your testosterone naturally. Now if you absolutely have to start TRT to improve your symptoms, then we'll talk about adding HCG to your TRT. That will improve your sperm count and improve your chances of having kids. If you have more questions, give us a call, give us a thumbs up and subscribe.